I'm Dr. Professor Alex Rhema Zachariah, MD, a retired physician from India, now settled in Urbana, Illinois since 2005. Both my wife and I, we are physicians and U.S. citizens. And I am trained in medical oncology in Indianapolis with Eli Lilly in the Indiana University Medical Center. I went back to India to start oncology work in North India back in 1972. Now we are here, retired, all our children, physicians, and all settled here. So we are in United States. So this show is facilitated by American Cancer Society, and we have the volunteers that volunteer to the American Cancer Society and the cancer survivors. They come here to tell the story. So we would have a number of them throughout this year, so it would be beneficial to all of us to hear that story for encouragement, comfort, and also it's educational and information. And I have today American Cancer Society volunteer Chris. Now tell us something about volunteering, then introduce.
Okay, my name is Chris, and I have been a volunteer with the American Cancer Society about 5 years now. I began by driving cancer patients from their homes to treatment and then back to their homes. I also work in the American Cancer Society office when they need anybody who will do some light clerical work, stuffing envelopes, sorting things. And lastly, I also do volunteer work at another location. But mostly I'm interested in the American Cancer Society because my husband succumbed to cancer 6.5 years ago. It's a charity that's very near and dear to my heart, and I am trying to do whatever I can to raise the awareness that there are great resources and employees as well as volunteers that work for the American Cancer Society. I do have a number for the local office. If you have any questions or concerns, you can reach them at 356-4861. There are many resources that are available to cancer patients. Please feel free to give them a call. One of the ways that I met Karen was through the Relay for Life, and it was about 3 years ago that we met. Karen and I were both on committees. I've been on the Luminaria Committee, and Karen, what were you on? I can't recall.
I just did general, wherever help was needed.
And that's exactly what she does at this point. Wherever help is needed, any committee that needs her help, she will get in there and get it done. It is an event that happens in summer. This year's event will be held June 8th and 9th, 2013, at Centennial High School on their track. It's an extremely fun affair. There are campsites that people bring tents, coolers, ways to cook foods. They do fundraisers. Just about anything you can think about, it will be there. If you are at all interested in participating in the Relay for Life, please give the American Cancer Society office a call. They'll get you in touch with our chair of the event or one of the committee members if you say that you're interested in a particular job to do. It's been a real fun experience. I've got to meet a lot of wonderful people, many of them who are survivors. And I'd like to introduce again, this is Karen. Karen is a survivor. And Karen, if you could just share your story with us, that would be wonderful.
Well, I first got involved with the Relay for Life 8 years ago. My mother had breast cancer, and she had gone 6 years without having a mammogram. And when she finally did, they discovered a 5-centimeter tumor in her breast. And they did a lumpectomy, which just takes the lump, and they did not get clear margins around the tumor. And so they went back a month later and took her breast entirely. And she went through chemo and radiation, and thought things were going well, and a couple years later, then the cancer came back in her spine, and lost her to that. So that's what started me in Relay for Life, just as a participant. And then I myself ended up getting breast cancer. My story is totally different than my mother's because I was having annual mammograms, and they caught my cancer very, very early with an annual mammogram. It was what is called DCIS, or ductal carcinoma in situ, which means it was still in the duct. It hadn't spread out of that. So I was very fortunate in that respect, other than they found 3 tumors, actually. And so due to that fact, they wanted to do a mastectomy on that breast, my left breast. And there was also a spot on my right side, which was benign, but with my mother's history and everything else, I decided to go ahead and have both my breasts removed.
Was that done at the same time?
Yes.
Both breasts?
They removed both my breasts and did reconstruction.
And how long ago was that?
It was in December of '08.
Okay.
So, and then that's when I decided to be on the Relay for Life committee, step up my involvement, and so very rewarding.
Can you, Kevin, tell the story of reconstruction, where it was done, and what was that experience like?
Well, actually, my reconstruction was immediate.
Yes.
Also, my surgery was 12.5 hours. And the type of reconstruction that I had, they took my abdominal tissue and they removed it and then moved it up here and reattached it with the veins and the arteries. This is not done locally.
Yes.
So I did go to St. Louis.
St. Louis.
I went to St. Louis to have my reconstruction. But for some reason, I just didn't want an implant, or I didn't, you know, that was just something I felt.
Yes.
Sure.
So I did go down there and have felt very good about it.
Now, do they do that sort of reconstruction now?
No.
Okay, it's still away.
It's still, there are very few doctors in the United States that do that type of reconstruction. When I had mine done, there were only 9 doctors in the United States that did that type of reconstruction. It's very tedious since they totally remove your tissue.
Yes.
There is another type of reconstruction that is done locally where they do take your abdomen, but they tuck the muscles up inside, but they have to cut your muscle. And that was another thing I didn't want. So there's a lot of different types of reconstruction. I highly recommend that you do your research on the different types because not what's for one person may not be
Yes.
right, or what the other person wants.
Exactly.
So,
Exactly.
and also with my story, I highly recommend your annual mammograms, because of mine being caught so early. I did not have to do radiation or chemotherapy. So I was fortunate in that respect.
We're very fortunate
Yes.
because chemo and radiation, while it is killing bad cells, it is also killing good cells. And from my understanding in working with the road to recovery patients, that it can leave you feeling ill. You may or may not lose your hair. There's just a lot of side effects that may be unpleasant that goes along with radiation and chemo.
Although necessary.
Totally necessary. Yes,
yes.
yes, I agree.
So we would now look into a few aspects. Number one, early detection.
Yes.
And with the incidence of breast cancer, not only in this country, all over the world, significant. So this is an important aspect that you would overemphasize.
Oh yes, yes. And if your family history
Yes.
shows the need
Yes.
to start your mammograms earlier, I believe now they're recommending at 40.
40.
That that you start. But if you have a family history, make sure you talk to your doctor,
Yes.
because you should start your mammograms sooner than that.
Absolutely.
You have any sisters?
I have one sister that's 4 years older than me.
So is she having the mammogram?
Yes.
And
yes.
so far it is...
So far, she's okay.
Okay. And she will continue to have the mammogram?
Oh, yes.
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 And doctors have assured her that it is all right. So
Yes.
very good. So that's early detection. It's so important because the early detection gives you tremendous advantage
Yes.
to get on top of the problem.
Right.
And also the problem of the disease coming back is very none at all.
Actually, yes. My oncologist actually tells me
Yes.
that he considers me cured.
Yes.
And that I have
Wonderful.
less than a 1% chance
Yes.
that my cancer will
Fantastic.
return.
Yes.
Yeah.
Yes.
That's fantastic.
So, and I still have my annual visits with him, with my oncologist, just to be sure.
Yes.
But yeah.
And how about, would you comment on self-examination?
Yes, well, mine was early enough,
Yes.
that I couldn't feel it, but that is a very important part because actually I work
Yes.
with a lady in her early 30s that found hers in the shower doing a self-examination, and she did have breast cancer and had to go through the chemo and radiation. So,
Yes. So we have the annual mammogram.
Yes.
So self-examination is as often as you take a shower.
Right.
Which is often. And so you would emphasize that aspect.
yes, very much so.
That you need to be conscious that this could crop up. So therefore, awareness and self-examination, and never fail your annual mammogram.
Yes.
Very good. And then the next stage, your surgery, since it was bilateral mastectomy, and so it was long. And what was the recovery period?
That was a good 6 weeks or a little bit longer.
Yes.
And when I did return to work, although I'm a secretary, so it wasn't, I still was only able to return half days
Yes.
for 2 weeks. Then I went 6 hours for 2 weeks before I was able to return full time.
So the removal and reconstruction was done side by side.
Yes.
So it was not two surgeries; it all comprehensive
Right.
one surgery.
Right.
That that stands to reason, and that also is a total job done.
Right. It can be done in two separate
Yes,
surgeries,
that's-
but they had told me if I had my bilateral mastectomy that I could be off 6 to 8 weeks,
Yes.
and then they would wait probably another month,
Yes.
and then if they did the reconstruction, I would be another 6 to 8 weeks, and working full time.
Yes.
I just couldn't do that, and so they did agree to do it all at once.
And you had no others, particular illness, diabetes or hypertension or anything. So you were in good health.
Yes.
Yeah, in very good health, and to do that. So that message is very clear, and it is true. Any other observation that you like to make?
Wow.
How about the emotional aspect? How did you, when the doctor told you, I mean, of course, the doctor told you a good news that
Yes.
this is inside
Really?
the duct, it
Right.
has penetrated and spread. So that was the good news. But was there a period you asked yourself why, or because your mother had this, you were on the alert? So tell us some of the emotional issues.
Well, first of all, I wasn't that well versed in knowing what DCIS meant,
Yes,
but just hearing cancer,
yes,
of course, does throw you off.
yes,
And there's so much your first day, it's mind-boggling at first. But one thing that I would suggest, which I did have, is when you go in for your appointments, make sure someone's with you, because your first visits, there's so much and it overwhelms you. And if you have, well, I had my husband and both my children.
yes,
And so there were things that I missed that my daughter picked up on. You know, it just helps to have that other set of ears and the support.
Right.
I have a fantastic support system, not just in my family, but where I work. And they were just phenomenal. And they always say too, and my mom was this way, to keep a positive attitude. Sometimes you get a little down,
yes,
but as long as you can keep a strong, positive attitude, it
Yes.
just seems to make things go by better. I tell the story with my mom. She did lose her hair
Yes.
with her chemotherapy, and she used a wig.
yes,
And after she'd had it for a little while, she started joking, and she said, you know, I've always wanted to be a redhead. So she went back and turned her gray wig in for a red wig, and she went for a redhead until her
Oh,
hair
more
grew
power
back.
to her.
So you can, you know, make light and just, you know, do
It
that
is
sort of
important to
things.
keep a positive attitude. Going back to when my husband was first diagnosed, it's like being dropped down a well and there's no bottom. But the next few days you come to realize that, first of all, many other people are in the same position you are. And your attitude and your support system means everything. If you have a positive attitude that you're going to be okay, you might have some limitations, but you just have to remain positive. In my husband's case, he had, of course, he had me and our 2 children and grandchildren that would always, he could fall on. It was not something that he wanted to talk about, but he knew we were there.
yes. So coming back to that support system, you had a marvelous family support system and friends and the workplace.
Yes.
Now, Chris, I'd like to ask you, if by chance anyone who is viewing we do not want them to have cancer, but if any of them do not have that kind of support system readily available, will American Cancer Society would be a good place to
It
start?
certainly would be.
Will you tell
Their
them something?
first thing is they should call the American Cancer Society office. Their number is 356-4861. There's a lot of resources available to cancer patients, and one that I'm involved in is with the Road to Recovery, where patients can be picked up from their home, taken to their treatment, and then back home again. Sometimes the doctors at the clinics will get in touch with the American Cancer Society office, sometimes not. So if your doctor hasn't mentioned anything, please give the American Cancer Society office a call. There are many, many resources available. Karen mentioned the wigs. There's a boutique in the office in Savoy, the American Cancer Society office. We have stylists who will shape that wig to fit your particular needs. There's just a host of other things that are available. Just call the American Cancer Society office, 356-4861.
And you brought a very important point, and that is, this is suspected, just right away get in touch with the American Cancer
I agree.
Society.
Yes.
In other words, it's once the diagnosis is confirmed through American Cancer Society and the support system, that person would be able to meet others who have gone through it. So
Definitely.
that way the support system would start long before the surgery, chemo, radiation, everything.
And keep increasing. There are more and more people who are willing to tell their story so that it might help others.
Yes.
And there is an 800 number
Yes.
that can be called 24 hours a day if the local office
Is closed.
isn't
Yes.
available.
I'm sorry, I don't have that
Yeah.
number.
No.
But there
We
is an
would-
800 number.
But there is a
That-
real person 24/7 who
Yeah.
answers that line.
Yes.
And you would just need to give your name and phone number and your location, and they would get you in touch with your regional office.
I also get the sense that American Cancer Society attitude and approach is one of a second miler.
Yeah.
In other words, they wouldn't say, oh, this is all we can do. No, they would
Yes.
just keep coming to help and to be of great help.
Yes.
And you agree with that?
I do,
yes.
because there are so many programs. I only know of a couple,
Yes.
but by calling the American Cancer Society office, you could be aware of, sometimes they have a prescription resource where they will help pay for co-pays or the
Yes.
prescription itself. There's just so many, and I wish I knew what all of them
You know,
were.
we would bring them one after the other in
Right.
our shows.
Okay, we will
Yes.
do that.
So, Kevin, would you give again your perspective and a few words that the viewers would appreciate from you?
Well, it's just real important to be aware of your body and to follow the medical advice that's given. Here again, if you're supposed to have annual mammograms, don't wait 6 years like my mother did. Do like I did and have your annual mammogram. The treatment can be so much easier if you have to go through it. And again, I'm going to echo Chris and the American Cancer Society, a very, very good organization. We're working and striving so hard to knock out cancer so that people don't have to go through what my mother or I went through.
Thank you. And Chris, can you mention once again about Cancer Relay?
I will do that. As Karen had mentioned, the resources that are there, the donations that the American Cancer Society receives, that is totally the goal of the relay and any Relay for Life member. We want to lick it out,
Yes.
get rid of cancer. And so you can participate in the Relay for Life, which is going to be held June 8th and 9th at Centennial High School on their track. We begin actually Friday night setting up and getting ready for it. There are many, many people who participate. We have a lap that is done by survivors. We have a lap that is taken by the person who is the caregiver. There are luminaria that are addressed by family members or friends that line the inside and the outside of the track. And about 8 o'clock at night, those are all lit and all the lights are taken down. We have a bagpiper who leads the procession, and it is just the most awesome sight to participate in. I'm getting chills just thinking of it. It is so meaningful that you remember any of your family members or friends during this time. And again, we want to lick out cancer. We want to get rid of it.
Thank you. And you will hear more about this cancer relay in the subsequent shows. And I thank you, Karen, for so clearly presenting a very lucid and straight talk on how we get on with it. And Chris, thank you for bringing Karen, and you would be having more of these episodes of American Cancer Society facilitated. The volunteers coming here and the cancer survivors coming here to tell us their remarkable story. Thank you for your time.